Hello everyone and welcome to this episode of Steve's Horse Show. Today I got Dr. Kim with me and she's going to talk about osteopathy. Osteopathy.
You got it. Osteopathy, you got it.
We are going to talk about a fancy word for stretching is what we're going to talk about today. And she's going to walk me through exactly what she does, a actual medical description of what osteopathy is, and why does someone call you, what do you do when you go out, blah, blah, blah.
Yeah, so I'm a regular veterinarian first, and then I learned the osteopathy after. So now I see a lot of people that will call me and say, my barrel horse, is running past the first barrel, or my pleasure horse is dropping in his left shoulder, my horse isn't changing leads, or my rope horse is stopping crooked, nervous in the box, nervous in the alley. We've had, things done. We've had, injections, chiropractic adjustments. We've had pain meds done. We've done Adequan. We're at a loss. I can't figure out what's wrong with this horse. The muscling's not developing like it should.
How many more injections can I take?
Yeah, they've spent a lot of money, done all things to help their horse, and they're still not to what they know they should be. But the horse is not limping. So what I do is called osteopathy. So it's a form of adjustment. So we mobilize like every vertebrae, every joint in the body. So we'll do the TMJ joint. We'll make sure the teeth are good, so the TMJ is good because the temporal bones will affect them. The hyoid, the base of the tongue, COC1, the atlas axis, has to rotate and shift both ways. And we'll go all the way down the horse's spine and make sure the vertebrae that are an extension can move to a flexion and vice versa, and they rotate both ways. We get all three axes of motion in the sacrum.
How many points is there? I mean, as far as like that goes of like, check this, check the, do you know how many exactly?
So, yeah, I'll kind of get my hands on the horse and feel like where their tightest area is, their sorest area. And usually once I start there and get that major kink worked out, the horse is going to relax and let me go through the rest of the body. But the first time I see a horse, I'll adjust maybe 25 to 30 different restrictions in their body.
And how long does that usually, I mean, like a typical... what did you call it? Or a session?
A session, yeah, adjustment. It probably takes 45 minutes to an hour. And sometimes the first time I see a horse, we'll spend an hour and a half on him to get everything mobilized,
Plus you got to hear the
down to the
Sally
legs.
did this and blah, blah,
right,
blah,
right. Get the whole story.
Get the whole story.
Yes, and I love to hear it. Yeah, yeah, and I love to hear it. Yep.
Okay, so just show me some of the stretches that you would do on a typical, first you would obviously like examine them, go through a bunch of stuff beforehand, but as far as like once you decide what a horse needs and what you want to work on, what do you do as far as, is it a 5-minute, is it a 10-minute?
Yeah, it depends like on the horse. So after I do a full osteopathic treatment on the horse, then I'll be like, okay, Lauren, to help this horse's muscle memory stay gone over the next 72 hours so that he doesn't pull himself back or, get things tight again, I'll have the owners do some stretches. So say I adjusted him in his shoulder, I can have her bring the leg forward. A lot of people will stretch here to get the skin out of the girth, but he's not stretching any muscles here. So I'm going to go ahead and advance that forward and let him drop right there. Did you see him drop? This whole shoulder dropped right through the whole shoulder blade. So we're getting a stretch through the triceps. We're opening from the scapula to the humerus, dropping him through there, bring the whole shoulder forward, which stretches the scapula and also advances his first rib. Okay. So that's something they can do.
And that's like an at-home deal you would recommend to do afterwards?
Yep, afterwards. Gotcha. Yep. So that's stuff that the owner can do. It's not gonna hurt the horse. Say I had to adjust his sesamoid bones here or his accessory at his knee, then I want him to keep that lengthening through his tendons. So then I'll have that owner stretch and hold the toe up and let that horse drop through the heel so that he extends through there and helps keep. You're fine. Helps keep the motion. Good boy. Helps keep the motion through there. Another one you can do to help their shoulder blade is to just hold this leg here, no pressure, and then I'll bring this knee back, and then I'm going to press it towards his other knee, and we're going to drop that shoulder blade down here. So it's kind of a press and release, and press and release. And this horse is pretty comfortable, so I'm going to come farther back and go press and release to where he's tight. So we're almost going to the back of the knee, so a press and release like that.
And are these all like stretches that you would recommend like for a performance horse? Is this all horse stretches? Is this? I mean, most people aren't stretching their horse, I guess, unless they're a performance horse. But what is?
Yeah, that's true. No,
what is this working on?
So this is working on. So this is a pro rodeo barrel horse. So he needs, you know, if we lose this much stride length on him and she gets beat by thousandths of a second, she's out of the money. So we want full range of motion though. So, you know, if he wasn't competing and his shoulders get jammed up, and we've got a stride here, the horse isn't lame, but he doesn't have that reach. So for an athlete, we want everything moving.
Helping move better.
Mm-hmm.
Gotcha.
Yep, move better. If he was, go ahead.
So those are 2 stretches that you would recommend, you know, doing like an at-home type build that you can do. What would you, I mean, once a day? I mean, as often
you
as
could do
think
once
about
a day.
Like athlete stretching, I mean, pretty much.
Yep. When it's hot like this, you could stretch your horse before you ride, and you get a nice, you know, free ride. If we're in the wintertime, you might get on and walk and jog around and you get those muscles warmed up, so don't stretch a cold muscle.
Right. Okay.
Yep, so 50 degrees is kind of the cutoff. Their muscles are happy 50 degrees and higher, so it's cooler than that. Walk them around and get them warmed up before you stretch them.
Right. Okay, what else?
So like on
Any other basic stuff, or is most of the other stuff?
Well, a really basic one you could do is get him to lift through their back. So that he'll stand here, but when you ride, that horse has to carry you, or should carry you, and come through, and you could see how nice his neck muscling is through here. So this horse, when he goes, he has to carry himself. So he's a sprinter, but he also has to stop and turn. He has to use his core. So to help him keep his abs and his back strong, you can just literally just ask him to lift his back up.
Huh, okay.
So this lets all the blood flow come from the spinal roots to get to all these muscles.
Okay.
It also helps him stretch that ligament over the top of his spine. Gotcha. Also helps warm the back up before she gets on and asks him to use it.
I mean, it's like kind of like the same.
Yep.
Gotcha.
Yep. On the hind, we can stretch these legs forward. So if you want to help him stretch through his hamstrings, or say I adjusted this horse's sacrum on this side, or ilium. So I've got a hold of his toe here. If he steps down, just let go. Maybe recommend doing it on sand in case he does. Be careful. And then you can use your other hand on the hock and just ask him to straighten that leg and go until the heel drops.
Gotcha.
You can see better here. So see how his weight's dropped through his heel, and I'm just holding the toe up.
And so talk about the adjustments too that you would do. You're talking about after I adjusted this, after I adjusted that. What does that look like, or what is that for like a basic overview? What is that? What do you do to a horse? Do you adjust the whole body? Do you just work on a specific area?
I adjust the whole body. So even I'm going to adjust this hind foot, this coffin joint. So I'm going to feel this pastern and make sure this coffin joint's rotating the way it should both ways. Okay. I'm going to make sure these sesamoids move up and out. Okay. Cuboid bone moves. This needs to move. I also check that the stifle exo-rotates and endo-rotates and goes evenly to a flexion and extension. Okay. We check the hip flex extension, ab and adduction. The ilium needs to move up and in, needs to move down and out. It also has to move forward and backwards. This is a great demo horse because I've taken care of him and he's ridden correctly, fed correctly, good shoeing, good dental. It's really what you need to keep your horse healthy. So all that feels good on him there.
So as far as like adjustments and stuff like that, that is like, how often do you do that?
Like this horse, probably we would see, 3 or 4 times a year is a perfect preventative maintenance. We don't want to get to where we're seeing a horse once a week or once a month, and if we are, we know we're missing something. We haven't gotten to the root of the problem. Probably the most important thing on these performance horses is going to be their SI joints, which are going to be deep in here, and so I want to check that their sacrum moves forward and backward like this, or tips forward and backward, and then it's got a left and right axis, and it moves this way. Okay. And then it moves, this way. Okay. So I want to make sure he's got motion in that sacrum both ways. Okay. And then I want to make sure that he can bring it down on both sides, and then I want to make sure that he can bring it up on both sides. So those are 6 different motions of the sacrum, and if he's got some of that stuck, then we'll mobilize that, have the owner follow up with a stretch. Another good stretch or exercises just to walk him in circles, where his inside hind crosses over in front of the other inside hind.
Okay.
That keeps all his pelvis and sacrum moving. And as far as adjusting the back, their spine is naturally in an S, just like ours is.
Okay.
So we have a flexion here. We go from extension from thoracic 13, 14 up to C4, and then from C3 to the occiput, we're back into flexion. So we go flexion, neutral, extension, neutral, flexion. So when I adjust those vertebrae that aren't rotating one way or the other, they have to lift or drop. So we get full range of motion. So it's a three-dimensional adjustment on them.
Okay.
Muscle memory is 72 hours. So if I adjusted your horse today, today's Thursday, so Friday, Saturday, Sunday, you could ride your horse. Yeah. So we try to time it to where, if you were going to go roping this weekend, we wouldn't see your horse
Guaranteed
today.
to win by next weekend.
That's right, 100%.
Every time. And so you'll send them back with some stretches, which will show, on. And what are those stretches working on? Is it?
So, like, say your horse was stuck in his sacrum and it's a rope horse and he wouldn't stop and turn. Well, he turns, like this and catches. So maybe his sacrum was dropped on the right side and it wouldn't lift up. So I'm going to have you stretch through that pelvis and that SI, and then I'm going to have you stretch that hind leg forward, do circles. So I'm going to write down stretches and exercises for you to do for the next 3 days to help your horse stay mobile. And I feel like the more the owner, rider understands what's going on with their horse's body, the more they can help keep that body good, and the sooner they know when something's wrong to bring them back.
Gotcha. And most of the time, are you doing this as first? Are you doing this as first? You try this first, and then, or do you do it in conjunction with like injections and stuff like that you talked about, or what is it?
Great
what
question.
Is your choice on that?
Great question. So before I learned the osteopathy, your horse isn't switching leads, or the back is sore, we'll flex them, we're probably going to inject hocks, and we might inject stifles. But since I've done this and realized how important that muscle development is, when the body's moving correctly and the sacrum and pelvis in the back, you get that beautiful muscling like we see in this yellow horse here today. And a lot of times we're not doing injections. Gotcha. We are still going to see horses with arthritis. Those are still going to need to be injected. Right. If we have an injury, I have a non-steroid injection, a rehabilitation treatment that we'll do, but the joint injections have gone way down, and so we're having healthier horses, more sound horses.
Just because there's no point in injecting something if the muscle around the joints and stuff like that, is that kind of your...
Yeah, so to me it's secondary. So no one's doing their horse wrong injecting their hocks if they're not doing well. Right. But if they see an osteopath and we can adjust them, they're not overstraining their hocks and stifles. So that joint that didn't have arthritis isn't going to need to be injected because it's being used correctly, not being overused from a disorder somewhere else in the body. Right. So we call that a compensation.
Right.
Yeah, gotcha. Exactly. So one more stretch you could do, and everyone thinks it's for their neck, and everyone wants to bring their head around here, here, and here, which is great to get side bending, but I also want flexion. So where I just told you these vertebrae are an extension, I want these to come down into a flexion, and if I come around, he's done this before, I want him to get side bending in his ribs, and I want him to lift his back. Do you see when he did that? Yeah, he used his abs, he used his back, he stretched his spine out through the other side. So this is a great stretch you could do on any horse. See how much he used his whole body right there to do that. So it's not just a neck stretch, it's like a whole body stretch. Gotcha. Be good for any horse. Yeah.
If somebody does tell you, you go and they say, Bob here has an issue with this or this, and you're pretty sure it's, in a certain area, what is your protocol? Do you still, continue to go over the whole horse, or do you just focus in on an area?
Yes, that's a great question. Some people will come and say, my horse is out in the pole because they pulled back. Well, if I just adjust that and don't address the rest of the diagonal tensions and the fascia in the body, it's not going to stay. So I go through the whole horse, from his head to his tail, from the spine to the feet. So that's why it takes a long time, but that's the goal, is to get the horse to where their body can hold well.
I want to adjust up here, and now this is off. And
So if I just adjust the compensation and I don't just adjust the primary disorder, we're going to have a problem again.
Gotcha.
Okay, so this is just an example of a sheet that we would fill out, circle the disorders that your horse had,
right?
Homework.
Yeah.
Dog ate it.
I didn't go to near as much school as you, but the little I did.
Yeah, so, yeah, I used to write them, sacrum disorder, left, ventral outflare, but none of that meant anything to the owner. And, I think it's important that the owner understands what's going on with the horse, where the restrictions were, what I found versus what they're feeling. The horses trotting along, and we lose a leg, and then we're trotting along again, like, well, that's because the sacrum was stuck. And we'll have that circle, and like, oh, yeah, I was feeling that on the right hind. And then, so I'll write the, disorders, what I find, and then they kind of have a little visual of what was going on and a list of the stretches to follow up with the first 72.
So not only this is what I've found is the issue, but also here's what you can work on for the next 72 hours and on from there.
Yep.
That's awesome.
And then whatever other, random things we might come up with, if there's another medical issue or whatever, we'll address it there.
Push-ups and stuff like that.
Push-up, yes, for the owner, yeah.